When you're working on the neck, again, we want to make sure that we give it time, 30 to 90 seconds. Fascia takes a long time to release, so we want to be patient. But when you're working on your neck, you look at this, it goes, look at all these muscles that attach. This is your neck, but these are your traps. This is the upper traps, middle traps, and lower traps. They're actually all the way into the neck there. So you could have issues coming from way back here or way down here. So when you're working the neck, make sure you're working into the upper traps, maybe even the lower, middle and lower traps a little bit. Come down to about where the last ribs are. And so you can place the balls on either side of the spine and work your way down this way. Do not roll. We don't want to roll on those because we could easily pop a rib out. So we want to be very careful and move slowly, one at a time, a couple inches down or an inch down or up or down, whatever you're going, whatever your direction is fine. And when we're working the neck, you can see that all these muscles in here come attached down in here. You're going to want to make sure you also release the pecs because these guys can pull and affect what's going on in the neck. So we're going to want to make sure we also work on the shoulders and the pecs when we're working on the neck. As we noticed on the muscle model, we want to make sure that we take care of the pec muscles. And the way the fibers for the pec muscles run on the bottom here, they run more diagonally up. As you get closer up here, they'll run more this way, more parallel to the floor. So turn your massage gun on high, and you're going to run with those fibers. Now you're angling the gun so you're not going straight onto the body like this. You don't want to be pounding straight into the ribs. We want to be more angled like this. We want to make sure that you're coming in at a very good diagonal, just like that. And you're following those fibers. And you're going upwards towards the shoulder where it attaches. These muscles attach right up in here. And just take a few good passes, making sure you're pretty much going from the sternum all the way to the shoulder. Keeping the massage gun on a nice diagonal, almost parallel to the body. As I get up here, it's more parallel now. And I work this area out. Now as I come in here, I'm going to get into the shoulder. This is the deltoids. So now this is the anterior deltoid. The deltoid fibers run up and down, slightly diagonal here, then straight up and down here, more diagonal here, this way. So I'm going to follow that. I'm going to go up and down here. It looks like downwards is easier, so I'm going to go down, straight down here. You can also go upwards on this one. Again, I'm still keeping the massage gun fairly diagonal, because if I try to go this way, it's going to be a little bit bouncy as I get down on the bone as well here. It's easier to make it go up and down when you're at a slight angle. When you get back into the posterior deltoid, you're going to want to make sure you're a bit more on a diagonal going towards the back here. You're angling from here this way, like that. So you're gonna get up in here, just like that. That's the back deltoid. And you want to try and get as far back here as you can. You may need to change how you hold the gun. Instead of going like this, maybe you need to go more like this and just push, just like that. Now with the massage gun off, in the off position, we're going to come in and take care of the scalenes in here. We want to make sure that we're not pounding here, so we want to turn the massage gun off. You're going to place the gun in this triangle here of the neck. So if you notice, they'll pop out. This is your SCM, the sternocleidomastoid muscle. So right behind that is right here, pretty much the side of the neck, but before the trap. So find the trap, here's your trap, you're going to be in front of that and behind the SCM right here. This is your SCM. If you turn your head slightly and look down like what's over there kind of thing, you're going to notice it pop out. So behind this and in front of the traps. So right in here. You place the gun in the off position right in here, making sure that when you press in here, you don't feel anything down the arm. If you're feeling pain going down the arm or shooting down the arm, you're pinching on the nerve. So change your angle, maybe go this way more and push backwards. And then you're going to turn your head away. So now you're stretching those muscles. You put a little pressure and turn away. Turn away. Pressure, turn away. Do about 6 or 7 of these where you just work on these muscles right in here. Angle it a little bit differently. Angle down a little bit. When it comes to the upper traps, as you get close to the shoulder part where it attaches in here, this is very bony for quite a few people. So you want to make sure that the angle of your gun is definitely more diagonal to the body and not straight on, because this is going to bounce too much. So we want to make sure you're coming in at a very good diagonal angle, and you try to cover as much of this trap as you can. Getting in close to the lower neck here, be very careful as you don't want to try and get up too high into the neck. Some people are very sensitive up here. Stick close to the lower end of your neck and make sure that you cover as much as you can of this trap. Instead of holding the gun too close to the neck like this, maybe try to hold it lower, so that way it gives you a better chance of reaching farther back this way. And you want to make sure you work on that for a good 30 seconds to 90 seconds. Try going slow and see how that feels, and then go a little bit faster and see how that feels. And maybe the combination of the two is actually what your body really needs. Now, let's head to the floor and work on the back of the neck. For the back of the neck, and especially the suboccipitals, we can have the 1-inch diameter pipe or the 2-inch diameter pipe. Both of these work very well with the neck. So if we're taking the 1-inch diameter pipe, we grab it just like this and place it behind our heads, right at the base of the skull. So it looks like this. This is where you're placing it. Now, you can actually lift one hand up higher and place your head a little bit more to the left, or if you lift your right, place your head a little more to the right. And you can work the two sides of under the skull, the suboccipital muscles there. You can also go straight on and work this area out for a good 90 seconds, making sure that the fascia has a chance to relax and loosen up. So try this, or try the 2-inch diameter pipe. Now, if you're feeling like you're not quite getting under the skull there, what you can do is do an outward rotation like this. So it digs underneath your skull there, and you can look up a little bit. Let the head fall back. And that gets right under there. Now, I will say, for going down lower into the neck, this can get a little sensitive, depending on your sensitivity in the neck. If I raise, so now the right side is on the floor, the left side's lifted up, and I can play around with where it hits on the neck. I can move it down, slowly rotate it downwards, and get closer and closer to that bottom of the neck. So my head is pointed slightly to the left. It's falling back a little bit, and I'm just rotating that pipe a little bit so it gets lower and lower down the neck. Or that sometimes does tire out the elbow. What we can do is, if again, place the one side down and the other one goes up actually over your shoulder. As it sits onto your shoulder, you can clasp your fingers together and rest your neck on that side. Find the tender or sore spots in the neck and wait a good 90 seconds. And then work the other side. Now, get the lacrosse balls out, or if you have a bit of meat on your bones, get 2 softballs. They're a little bit bigger in diameter, so that'll work better. We're going to find the lowest ribs, and we're going to place the lacrosse balls on either side of the spine and work our way up, or start at the top and work our way downwards. But we're not going to roll. We're going to place the ball, and we're going to lift off, then place them down up a little bit, and so on. Work our way down. The side of the spine for the lower traps and middle traps, which we cannot get with the massage gun. So we're going to place them on either side of the spine, right where the lowest ribs are. So to place them here, make sure you put them to the side of you till you're able to lie down. Now we're going to lift up and place them right underneath those last ribs, close to the spine. You can lift your knees, and you can play around with your arms like this. As you extend your arms up, you're pulling on those fibers of the lower traps. This is pulling on them right now. Then I'm going to shift my weight by lifting up and shimmying down a little bit. I don't want to roll, because I have done that and I've popped a rib out. We don't want to have that happen. Now, as I'm a little closer to the middle of my back, I notice I don't need to lift my knees anymore. But if you do need to, lift them up, put that extra pressure on there, and again, extend your arms. This is again about 30 to 90 seconds of this, making sure that you relax and breathe. Get that fascia to relax and under the pressure. Lift up and shimmy on down a little bit and get your way up towards the lower part of the neck. Now, when you get up here by the lower part of the neck, what you're going to have to do is play around with where your arms are. You might have to lift your butt off the ground, so that way the pressure goes into the lacrosse balls now. And if you notice that you can do something like this, now you're stretching those rhomboids as the pressure is put on them. You can work your middle traps just like that, getting those lacrosse balls to dig in a little deeper under in between the shoulder blades and the spine. And wait there for 20-30 seconds, then play around with maybe crossing them like this for 20 to 30 seconds, and just work that out however you feel like it's getting in deep into those muscles, and try to relax and breathe and let the fascia go.